And now, so today, as you see, we are going to continue speaking about working in general practice. And so we start with the analysis of your home assignments. We were speaking about the difference in the use of the present perfect and the past simple tense. And so most of the students understand this difference, but some students do not understand, I mean, do not remember even the forms of the past simple and the present perfect. So let us focus on some of the sentences. So there are some screenshots on this slide. Do you see the presentation?
Yes.
Okay. So, for example, if we focus on sentence 3, yes. The student writes, I studied German at school, but I forgot most of it now. I mean that here the student just feels that it should be present perfect because the time is not mentioned. Yes, so the sentence is about the result in the present, but the student doesn't remember the form of the present perfect tense. It consists of two parts, have or has, plus the third form of the main verb. It should be, I have forgotten most of it now. So we shouldn't use past simple. Some of the students try to use I forgot, just past simple, but the time is not defined here. So the focus is on the present result. So the next sentence, that was number 6. Are you ready to go? Did you finish your coffee? So the same, the time is, we don't mention the time. The focus is only on the result. So have you finished or haven't you finished your coffee? That is why it's better to use the present perfect tense here. Have you finished your coffee? So in number 9, quick, we need to call an ambulance. There was an accident. When was the accident? We don't know this. The sentence doesn't tell us about the time of the accident. That is why we should also use the present perfect tense, like there have been an accident. Have been, this is the present perfect of the verb to be, which should be used here in the sentence, in the gap. Well, and so the next slide is about the sentences where we need to use the past simple. In sentence number 4, for example, the student writes, the police have arrested 3 people, but then they let them go. It's like a succession of action. The police did something first, and then they let them go, the following action. If we have 2 actions that follow each other, we should use the past simple tense. When you tell a story to somebody, you describe the past events, you should use the past simple. So it should be the police arrested 3 people, but later they let them go. And in sentence number 7, a student writes, I have applied for a job as a tour guide, but I was not successful. The second part of the sentence, I was not successful, tells us that it was after the person applied for a job. It was later. So the same situation. First I applied, then I was not successful. So two events following each other. That is why we need to use apply in the form of the past simple tense. I applied for a job. And so in this sentence, sentence number 11, the student writes how that happened. So it's grammatically incorrect because this is the question, and we make up a question with the help of auxiliary verb did here. How did that happen? So you should revise so the how the questions are made in the past simple tense. So do you have any questions about the homework? Hello? Alia? Do you have any question?
No.
No. Good. Esginur?
No.
Well, Jeren?
No.
I see. Well, so now, yes, last class we listened to the presentations of some students, yes, and today we've decided that today we'll listen to one more presentation, Culture Project. I guess it is about Calgary-Cambridge method, right?
Right.
Okay. And so it means, so who are the members of the group that prepared this project?
Me, Zaina, Dilara, Ala.
Zaina, Dilara, Ala. Three, right?
And me,
And who? Your name is Buse, right?
Buse. Yes.
4 girls. Well, and now I'm just giving you. Right.
Can you give me the consent?
Before, just let us remember the criteria that we should use to evaluate the presentation. We were speaking about this last class. I mean that the criteria we should evaluate the how the content, how useful and interesting the content is. Then the organization of the presentation, how logical it is organized. Then the what was whether the delivery, like whether the speakers just say something, do they speak or only read from the slides. And we should also evaluate the visual aids of the presentation. Well, so you may share the screen now. You have the right to share the screen. Do it, please. Hello.
Okay, yes.
So, and the other students, please watch the presentation, and I'll ask somebody to say some words to evaluate it.
Can you see the PowerPoint?
Yes, I can see.
What about the second slide? Can you see it?
Right.
Okay, so today we're going to be talking about the Calgary-Cambridge method and with the introduction. Ala, please.
Okay, so the importance of communication and obtaining good healthy outcomes is well known. Communication is a teachable skill which is incorporated in the training of medical professionals at tertiary institutions worldwide. The teaching of communication skills is often based on the models of communication, the products of extensive research, and providing frameworks for gaining clinical data. building rapport and deciding on clinical management. Kurtz and Sliverman introduced the Calgary-Cambridge reference observation guides, which they further refined in the early 2000s. These guidelines, which present the medical overview in 5 steps, are the result of the collaboration between 2 very experienced teachers in clinical communication. The guide was originally intended for use in clinical education at tertiary institutions. The model has since been adapted and used in various health disciplines and serves as a blueprint for many educational institutions in the teaching of education to aspirant healthcare professionals. Kurtz and Silverman introduced the Calgary-Cambridge referenced observation guides, which they further refined in the early 2000s. These guidelines, which present the medical interview in 5 steps, are the result of the collaboration between 2 very experienced teachers in the clinical communication, and it was originally intended for the use of the clinical education at tertiary institutions, but the model was adapted and used in many different health disciplines, and it's like a blueprint for many educational institutions. I think it's, can you skip to the next slide?
Yes.
Okay. So the Calgary-Cambridge model is presented in 3 diagrams, which aid to enhance the communication skills training visually. And the first diagram, which is figure 1, summarizes the medical interview as a sequential 5-step process. Initiation of the session, gathering information, physical examination and explanation, and planning, and closing the session. Initiating the session, which is the first step. So the first physical encounter between a patient and a clinician sets the scene for the entire medical management to follow. The first impressions count, and it takes more 6 seconds to accurately identify a nonverbal behavior indicative of the personality traits, and once an opinion on a person is formed, it is often difficult to undo. So the first few minutes of a patient-clinician interaction will determine to the extent of which the patient will share information with the doctor, offering a safe and empathetic place for the very first moment. The patient encounter will reduce potential anxiety and put the patient at ease. The Calgary-Cambridge guide provides 3 steps for the initiation of the session, which is preparing for the encounter, establishing rapport with the patient, and identifying the reason for the consultation. Only once these objectives have been reached, an interview can progress to information gathering.
Now with Dilara.
Yes, I want to talk about gathering information, process skill for explanation of the patient's problem, patient's narrative, questions still open the closed count, attentive listening, facilitative response, etc. Content to be discovered is examined under 3 headings. The biomedical perspective, the patient's perspective, background information. The biomedical perspective is sequence of events, anti-symptom and analysis, relevant system review. And background information is past medical history, drug and allergy history, and family history, personal and social, and review of system. And the patient's perspective is ideal and belief, concerns, and expectation, effects on life, feelings. Yes. Physical examination. How is a physical examination performed? Before meeting with your PCP, a nurse will ask you a series question regarding your medical history, including any allergy, past surgery, or symptoms you might have. They may also ask about your lifestyle, including if you exercise, smoke, or drink alcohol. Your PCP will usually begin the exam by inspecting your body for unusual marks or growth. You may sit or stand during this part of the exam. Next, they may have you lie down and will feel your abdomen and other parts of your body. When doing this, your PCP is inspecting the consistency, location, size, tenderness, and texture of your individual organ, as well as using special technique to detect abnormalities, such as stethoscope and percussion. Buse, I think.
Buse.
Yes. Okay, sorry. The aim of this step in the healthcare consultation is to empower patients with the knowledge regarding the nature of their condition. Different treatment options are prognosis and alternative option in the case of unsatisfying outcomes. The medical information should be communication in a way that is easy to understand and can easily be recalled. Recall of the medical information proved is crucial, and the insurance of patient remember and complete the data relevant in order to make a well-considered decisions regarding further management. There are three options regarding the content of the explaining and the planning Calgary-Cambridge model. The focus could be on the pathology itself, discussing the signifiers of the problem. The conversation can revolve around the negotiation of a plan action which mutually acceptable of both the patient or family unit, the healthcare practitioner. Possibly further investigation and or the provocation can be carried of the discussion. In most cases, all of the three options we will vote in the feedback and planning decision, but depending on the specific patient scenario, the focus of the conversation may incline more towards these options. In either case, it's important for the patients to have sufficient information regarding the presenting condition, including pathological course of the disease and the treatment options. Others.
Okay, and now with the last step of the Calgary method, closing the session. Closing refers to the final phase of the medical interview in which both the doctor and the patient shift their perspective from the present to the future, consolidate and finalize plans for further management, and closing is often disregarded as an important part of the medical interview, and research indicates that a proper closing dialogue may be omitted altogether in many clinical scenarios. Closing provides the clinician with the final opportunity to ensure the proper comprehension and commitment from the patient, and it also plays a significant role in patient satisfaction, like the likeliness of coherence to clinician instructions, and as a result, the outcome of treatment, obviously. And during closing, the clinician should summarize the outcomes of the visit and clarify the plan of care which was formulated during the shared session. Check for the patient understanding as well as unaddressed concerns, and establish plans for the interim, all while demonstrating care and compassion with the patient. And this phase is divided into two parts, namely forward planning and ensuring an appropriate point of closure. Forward planning consists of contracting with the patient regarding the next steps of the treatment, as well as safety netting. When ensuring the appropriate point of closure, a brief clarification and practically, the closing of the session may comprise a short dialogue with only a couple of sentences. Can you hear me?
Yes, we can.
Okay, so now in conclusion, as my teammates said, that initiating the session consists of preparation, establishing initial rapport, and identifying reasons for the reason behind the consultation. The gathering information, they might explore the patient perspective, biomedical perspective, and background information. And then that they do the physical examination, and then the explanation and planning provide correct amount type of info, accurate recall or understanding between the patient and the doctor, shared understanding, as well as planning for the decision making. And closing the session, we in this phase, they do ensure that appropriate point of closure and the future planning. And while they do these 5 steps, they provide structure. They make it like as a organized overall. And in building a relationship, they ensure that the appropriate nonverbal behavior, as well as like developing communication with the patient. And thank you for listening. That was the end of our presentation.
Okay, thank you, ladies. Does anyone want to comment on the presentation? Evaluate it. Yes, anyone? So what if we ask, for example, Mustafa?
Yes.
So what can you?
I think presentation was very informative. It has lots of knowledge, and I think it was well organized. I mean, the order of they. Sorry.
Yes.
They present was I think good, and it was interesting. That's
can you give any recommendation to improve the presentation?
It might be text was a bit too much. It could be a bit less, I think.
Okay, thank you, Mustafa. I agree with Mustafa. So the design, I like the design. It's like the design of the slides is eye-catching and so impressive. But anyway, so the presentation lacks of pictures, illustrations. So you may just find some more pictures to illustrate the ideas which you are speaking about. And yes, I agree that there is too much text here, and you should just divide it or adapt the text or shorten some parts. For example, when you were speaking, commenting on the last slide, so you've summarized everything. So it means you should just show the diagram and speak about the diagram, not just read from the slides. Well, what I like is that you speak about the history of the method. You've found the information and you understand what you are speaking about. And I think that it was useful for everyone, for you and for those students and for me who will listen to you. And ladies, I would like to ask a question. There was a abbreviation, PCP. What does it stand for? Because we used to the abbreviation, for example, GP. What is PCP? You can answer.
Primary care physician.
Will you repeat, please?
Primary care physician.
Paramedical physician?
No. Primary care physician.
Primary care physician. Yes, I see now. Mhm. Okay, thank you. And yes, so that was the last group. So yes, good. And now let us just go back to the presentation. And so today we continue speaking about working in general practice. And the first task is a listening task. We are going to listen how to the conversation between Mr. Bloomfield, a 28-year-old civil servant, and he is visiting locum GP, Dr. Dixon. So, and we are going to look at the notes, and so we should answer the question, why is past medical history, family history, personal and social history important? So first, let us look at the definitions. We say that Mr. Bloomfield is a civil servant. It means an employee of the government, like a teacher or a doctor, a person working for the government. And locum GP is general practitioner who stands in for another doctor who is temporarily away on holiday or off sick. And so the question, why these parts of medical history, family history important? So if we have a look at, yes.
Listening to
This form, and let us focus on, yes, on the questions. Why is taking family history important? Who can answer? Mohammed? Mohammed, are you here? Hello?
Yes.
Yes. So why the past medical history important? Why family history important? Social history? Can you answer this question, Mohammed?
Why the medical history important?
Yes.
To understand how did things developed, or how did ideas developed until we reach to what we are doing now.
Mm-hmm. Okay. So what does Zaina, what do you think?
I think a family health history can identify people with a higher than usual chance of having some common disorders. For example, high blood pressure or certain cancers, for example, or diabetes. These disorders are influenced by genetic factors.
Yes, they inherited sometimes. Yeah. Okay. Yes, and of course, it's very important to know about allergy when prescribing the drugs to medicine to the patient. Well, and now we are going to listen and complete the form. So here there are several abbreviations. So PC, there is here. So this is, it stands for, what is it? PC, presenting complaint, right? And HPC, here in this paragraph, this is the history of presenting complaint. And then PMH, so this is post-medical history. Yes, the rest is clear, I guess. And we should just understand the meaning of the following words. They are given to the right contributor. It means helping to cause precipitants, factors which cause something. They come before something. And siblings, you know, brothers and sisters. Now we are going to listen to the recording, and please just on your paper, please complete the gaps, write the words so about here in the gaps while listening. So let us get started. And
Listening to.
can you hear?
Yes.
Mhm.
Listening to.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?